Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the dental plaque and caries. Dental plaque is a glue gelatin-like substance that adheres to the teeth. The initial action that causes the damage to tooth occurs. The length of the time acids are in contact with the teeth, the strength of acids and ability to saliva to neutralize them, and the susceptibility of the teeth to decay. Dental plaque and caries. Dental caries refer to a destructive process of tooth decay that begins with presence of plaque on the teeth. Dental decay begins with the small holes, usually in the fissure or in an area that is hard to clean. Prevention. Effective mouth care, reducing the intake of the starches and sugars, applying fluoride to the teeth, reframing from the smoking, controlling diabetes, regular dental visits. Next is the gingivitis. The gingivitis is inflammation of the gum tissue, causes bacterial plaque, poor oral hygiene, food debris, and calcium accumulate. There are the gingivitis, inflamed and the receding gums plaque. Clinical manifestation is red gums, swollen, painful, and bleed easily. A change in the color of the gums from healthy pink to dusky red, bad breath. Treatment is the good oral hygiene and regular dental care, teeth cleaning and plaque removal, surgical removal of the diseased gum tissue, doxycycline 100 mg per day for 1 week, ibuprofen 400 mg POPRN. Periodontitis is the inflammation and the infection of the ligaments and bone that support the teeth. Periodontitis involves the progressive loss of the alveolar bone around the teeth. Causes are the poor or ineffective oral hygiene, poor nutrition, underlying medical issues such as diabetes, microbial plaque, accumulation and smoking, and may resulting from untreated gingivitis. Clinical manifestation are the redness or the bleeding of gums while brushing the teeth or biting into hard food, gum swelling, Ganglial, ganglial recession, spitting out blood after brushing teeth, bad breath, and a persistent metallic taste in the mouth, loose teeth, and a deep pockets between the teeth and the gums. Treatment is the metronidazole 500 mg peptide for the 7-day TID, 3 times in a day, and amoxicillin 500 mg PO 3 times in a day for 7 days, ibuprofen 400 mg PO/PRN. Then the patient is appointed after 1 week. Periapical abscesses, it is a collection of the pus usually caused by an infection that has spread from a tooth to surrounding tissues. An abscessed tooth involved a collection of pus in the apical dental peristom. Next is the periapical abscesses, clinical manifestation, a dull, gnawing, continuous pain, sensitivity to color, sensitivity to cold or the hot food and the liquid, a foul taste in the patient mouth, fever and malaise,